Amber here from LoveFit and She, and this is week 37 of my Healthy Happy Pregnancy video series. So I'm 37 and a half weeks today, and I wanted to go through a few little things you can do as a kind of very gentle circuit, kind of pre-birth in these last few weeks before the baby's due. So as I've said, kind of in your third trimester and certainly in that last month or so, you're really looking at tapering your exercise. No matter how fit and healthy and strong you feel, you don't want to go into labour feeling tired and exhausted from a really heavy workout. It's not beneficial to anyone. So what we're looking at now is really how to get the best out of your labour. And I've shown you a couple of weeks ago a really nice pelvic mobility routine to try and keep lower back pain at bay, open up the pelvis. But when we get into this last month, and we're talking from sort of 35 weeks, we really want to focus on asymmetric work, and by that I mean kind of uneven work. What actually normally happens towards the end of pregnancy is the left hip moves forward slightly and the uterus tilts to the right, and that's what it should do. So what you don't want to be doing is going at this late stage and seeing an osteo or chiropractor to try and fix that. There should be some asymmetry. And that's because the most favourable position for the baby is actually to have the head down on this side and the back along here. So with their back along your stomach, but usually on the left iliac side here. The other position that babies tend to favour is the right, with their head actually this side, which isn't great because it means they've got a lot further to turn. Now, in order to encourage the baby onto this side, as I say, there's lots of things you can do. You'll have heard them in NCT classes and from midwives and all this kind of leaning forwards and rocking the hips, and all of that's great. But what we actually want to try and do is open up this left hip and encourage the baby that way. Now, as it happens, my baby is going against the grain of it and is in a good position. It's head down, engaged already, and got its back to mine, but it's on the right side. That's less of a common position. Still great because it's not too far for it to turn, as long as the baby doesn't try and swivel around towards my back. I'm still going to be doing all this uneven stuff to try and open up this left hip. That way, hopefully the baby's going to move that way rather than the other way. So from 35 weeks on, you can try, there's lots of things you can do, but as always, I'm just going to show you a snippet. Try some of these exercises, and if you want a more gentle kind of routine anywhere in your third trimester, then do these exercises, but do them both sides until you get to around 35 weeks. It's only really in that last month that you want to start doing the one-sided stuff. Okay, bit of a long introduction, but let me now show you very quickly just a couple of things. So one thing that's really great is to put your foot up on a step. You can do it on your stairs, or if you've got a step like me, anything like this. And you just want to have one foot up there. You can rest your hands on your hip, and you're just going to lean in, just gently lunging across to that side. So the foot's slightly turned out, my other foot stays flat on the floor, and you're just pushing across here. And just do this, as I said before, there are no kind of set numbers or times you should do this. It's just to open up that hip and encourage that external rotation of the femur and the left hip. So doing a few of these in a little circuit. As I say, if you're before 35 weeks, you then switch sides and do it on the other side. But for me and anybody who's beyond that 35th week, we're just really working on the left. Another one is, again with the step, just to push yourself up. And as you'll notice, as I push myself off my right foot, my right hip ends up slightly higher than my left hip. Okay, and this is just really working through that left hip. So I push off the floor with this leg, but if you watch where my hands end up, that right pelvis lifts up higher than the left side. Again, just pushing up here. Okay, there's a whole other bunch of things, so I'm not going to show you all of them. But a couple of other great things to do on the ball. Any kind of asymmetric work is fantastic. So anything where you're just moving from side to side, so just rocking the hips like so is lovely. One we call the kind of half circle, where you go from one side around to the other, just really gently kind of moving around. Let me just show you that from the side. So I'm going from one side, pushing my hips back, circle round, like so. And again, that's just moving the hips unevenly, just pushing around. It's a really nice movement. You can also rock forwards and back on the ball. This one's actually particularly great during labour. If you get crampy legs, this just stretches out the legs a little bit, so you're just rocking there. Now, that's what I'm going to show you for today. So you've got the two on the step, your foot up, lunging, lifting up the right leg, and then just any kind of uneven side to side rocking movements on the ball. One last thing I did want to say though is that you'll probably have noticed throughout most of these videos, I haven't really done a lot of ball work. Generally because throughout pregnancy you want to be functional, you don't just want to be sitting on a ball. Life generally does not involve sitting on a ball, it involves standing up and looking after your child or children and cracking on with things. So we've tried all the way through this to keep you active and on your feet predominantly and work the glutes. But now that we're in those final few weeks really, and baby, you know, baby is a term, baby could come any time, we are now looking at things that are really preparing us for birth and for labour itself. And the ball is a fantastic birthing tool because it allows you to take the weight off your feet and rest a bit whilst remaining upright. Lying on your back, as I've said many times, is not a favourable position. And if you're sitting down on a sofa, you tend to end up in that slouched bucket position. But on a ball, you naturally end up with that good posture and slightly tilted forwards with your hips higher. You'll notice this ball is quite deflated. That's good. You want a slightly bigger ball than you would normally use and a little bit of softness in it, just so that you've got a right angle here at the knees and a bit of give in it. But yeah, birthing on the ball can be a really nice way to go through some of those earlier stages of labour and to save on those leg muscles before you then maybe go into some more active kind of squatting or kneeling positions for the expulsive phase of your labour. Okay, so I hope that helps. But yeah, if you're past 35 weeks, we want to open up that left hip. So do exercises that encourage the hip to open, anything asymmetric, anything moving, and just do these a few times round, nothing more strenuous really. Go for a gentle swim. One thing I should say actually is if you have any symphysis pubis dysfunction, so any pain down the front of your pelvis, doing these wide leg positions like the lunge or breaststroke in the swimming pool are not ideal for you. They're going to actually make that pain worse. So if you are getting in the pool, maybe front crawl very gently or holding onto a float and just kicking your legs, and stick to some of the more narrow-legged positions here rather than taking the legs wide apart. Okay, but if you're feeling good, get lunging, open up that left hip, and I will see you very soon for week 38. And yeah, look forward to it. Thank you for watching. Bye.